DCARA.
D-I-C-A-R-A. Shout
Okay.
out.
I can't say the Board of Health loves the Caras. We eat
Here she
there all the
is.
time. Carrie.
Yeah.
Hi.
Hi, Carrie. Hi, Jerry.
Jerry.
Hi, Carrie.
Jerry.
And Jerry. Yep.
Is Kevin coming too?
I bet. I don't know what's going on with Nancy Doctor. She's trying to connect.
Let's see.
She probably needs to do something. Shut off and try on again. I don't know.
There's Carrie again.
Yeah, we'll give Kevin one more minute. We'll get started.
How are the Woo Sox doing in Polar Stadium? I wonder. This is not
haven't been following.
Budweiser. I know. I think they started though.
I have family who've been to a couple of games. They said it was a nice experience.
Really? It's a brand new facility, so it must be nice.
Hi,
Hey,
Kev.
Well, Kevin.
Hey, Kevin. All right. So why don't we get started? Call the meeting to order. So tonight, let's see, we have public comment, and hopefully Nancy will connect if she wants to weigh in on anything. And then we're gonna hear from Brian Farless. Hi, Brian. And I'll let Peter introduce him and the whole issue around mosquito control. We'll get an update on the Reading Coalition from Kevin. I think we moved the health director update into the Health Division monthly report, and we can do it then. We have 2 sets of minutes from May and June 3rd. We'll review. We'll do the reorganization voting that I commented on last time, and we'll wrap up. So, the only person I see here is Nancy, and Nancy, did you want to make any comments or statements with the board? Or if not, you could stay muted and we'll move on. Okay, so I'm gonna turn it over to Peter to introduce Brian and the next topic.
Thanks, Dr. Lopez. I saw Brian Fallis for the first time in my life just a little bit ago here. We spoke a couple times, but I gotta say, I'm not qualified to give a decent introduction of Brian, but I think it's real important. I know something about mosquito control from my years as a health officer in a neighboring county. But Brian sounds, and we seem to share a lot of values, and he sounds like he's ready to talk about it at any length. And so why don't we begin with an intro from you, Brian? Give us a little bit about your background, please. I don't know where you went to school and how long you've been doing this stuff and so forth. Go ahead.
Yeah. So I'm Brian Farless. It's the superintendent for East Middlesex and Suffolk County Mosquito Control Projects. I have been in mosquito control for about 9 years or so. A superintendent for about 4 years. Dave Henley was my predecessor, if any of you worked with him. And he was at East Middlesex for, oh my gosh, between East Middlesex and Suffolk, over 40 years, I believe. And I came from a background in doing wildlife conservation work. I had quite a few different jobs, before working here doing that type of work, where I would travel around and just do different field work jobs. Not with mosquitoes though. This was my first. I'm not an entomologist. I didn't study sciences in school. I studied communication. Went to Radford University in Virginia, and communications with focus on public relations. And then shortly after that, got into wildlife conservation. That took me around different places, doing work with bats and tortoises and fish. So that was really fun. And then I landed here to do that. So now I've been in it for a while. I really do enjoy it. It still has a lot of field work aspects to it, and I enjoy the science behind it all. Everything changes as everything's always changing, right? So species are always changing, disease is always changing. So it's really interesting. Different methodologies are changing. Yeah. So yeah, I guess that's my introduction.
There you go.
Do you want me to just go into what we are doing in Reading, or?
Yeah, you know,
I think it would be helpful to kind of get a sense of, the agency you work for, what's the geographical coverage, and then and then kind of what are the steps you take each season around mosquito control. Peter did forward a document that I think you probably gave to him that
Yeah.
outlined some of the procedures. And so I think the purpose of this is really to inform the board about what we can expect over the next 3-4 months, or at least until the first frost.
Sure.
And how we would communicate with you. And then we can have the board ask any questions that they have.
Okay, great. Yeah, so we, East Middlesex Mosquito Control does mosquito control work in 26 cities and towns. We're under the Department of Agriculture and overseen by the State Reclamation and Mosquito Control Board. East Middlesex also has a commission that makes the decisions for us. We are funded through voluntary appropriations. So Reading, I don't know the history behind this. It was already set up when I came in, but there has already been established what services we're going to provide to Reading. So what those services are is everything from, well, I'll just list them. We do ditch maintenance. We do larval control in both wetlands and catch basins and any other artificial containers. We do trapping. We're doing 3 different styles of traps targeting different species, and certain species are being submitted to the Department of Public Health to be tested for West Nile virus in Tripoli. And we're doing adult mosquito control. We have 2 methods for that. One is using a pickup truck with a big sprayer in the back, and then 2, a backpack doing perimeter treatments. So in Reading, we're doing all of those services. We start out in the spring doing a helicopter application targeting mosquito larvae, in addition to walking into the wetlands and applying BTI by a manual backpack. And then we move into doing catch basin work. So we'll apply a larval control product to the street side catch basins in Reading. And what we're doing there is targeting the primary species, the vector species for West Nile virus, Culex pipiens, restuans. And as we get high, or we're also doing the trapping. We're using 2 different types of traps in Reading. One of them is targeting that West Nile virus vector, and then another trap is targeting mammal biting mosquitoes. And certain ones of those we're sending specifically to look for Tripoli, sending to the lab to be tested. As we're finding high mosquito populations, particularly vector species for Eastern equine encephalitis, then we can do a truck spray. We always give Reading a 1-week notice. I've been communicating with the health director, Jean, and the Reading advocate. We always give a notice there, and I think Reading is putting it on their website. We put it on our website, so we give proper notices to the public before we do that work.
Who is the Reading advocate? Who is that?
The local newspaper, the Wicked Local.
That. Okay. I thought it was a personnel position or
Oh
something.
yeah, sorry.
Okay. No, okay. Yeah, that Reading. Yeah, sure.
So, I mean, that pretty much wraps up our services in Reading. So just to say where we are right now, we have been larviciding since early April. That slows down at some point. And then once we get large rains, then we could go out and find more mosquito larvae. But we're getting to a point where we're not having a lot of larvae in wetlands. They've already kind of come out. And then we have summer species that are now coming out, but that's not a species, that one in particular, which is our most important for Eastern equine encephalitis. It's hard to get that in the larval form because they're down in the muck and they're breathing through root systems. So the common name is the cattail mosquito because they're down in the mud. So the product that we use typically, BTI, when we're walking through with a pump sprayer, isn't getting that mosquito. So that's the one that we're specifically looking at. When we start getting high populations, then we may determine that it could be useful to truck spray and get it in the adult form. So right now we've finished larviciding. We'll continue to larvicide as we're getting large rains, and then we're trapping, we're testing, and we'll spray once we are finding high populations.
Is it okay if I just
Sure, go
ask a
ahead.
couple questions on this, just for points of clarification? I was not aware that we were doing a delta sighting yet, Brian, and maybe I misunderstood you, but we've already begun spraying pesticide at adult mosquitoes?
We haven't done it yet in Reading.
Okay,
We're actually starting, the East Middlesex District is starting that program next week, but we won't be in Reading next week.
All right, and then I think I heard you say something about you're going to notify us a week in advance?
1 week in advance, yeah.
Okay,
That's what I've been doing the past couple of years, and I'll continue to do that.
well, I deeply
So
appreciate
you'll
that.
be on that notification list.
Thank you. And I deeply appreciate that. That's a courtesy that goes beyond other mosquito control districts that I've worked with. So thank you. But maybe this is a perfect time to talk about, where residents can sign up to avoid getting sprayed. And I think I used the term last time we spoke, Brian, I don't know if I said this, do not spray list or whatever it's called. Can you just firm that
Sure.
up for us, please?
Yeah, so that is it's under the Department of Agriculture website. You can exclude your, I guess it's called property exclusion. There's
That's it. Yeah.
a link there that you can exclude your property to be sprayed. A resident would have to do that once per year. Just do it before the mosquito season, and that will ensure that we won't spray within 300 feet of their property.
Now, this is an important point for everybody to get. Anybody who's watching or listening or reading our website, Schwung will put this important point on, and that link is found on Brian's website, but it'll also be on Reading's as well. That will say the property exclusion guide, I guess, protocols or the processes. You begin with this button, and then it'll prompt you along so you can get no pesticide sprayed to within 300 feet of your property if that's your desire. And I think that's great.
Yeah.
I should mention, I was just looking on the Board of Health website, went to Public Health Services. There's a series of topics, and I clicked on mosquito-borne disease information, and it has a link to the Massachusetts Department of Health information. Unfortunately, when I click on it, it says this, I can't access that page. And that's the only current information. So what you're saying, Peter, is Schwann will sort of build on this website the ability to log on and not be sprayed, and maybe and all the information about what Middlesex is doing. Is that right? Is that my
That's
understanding?
exactly right. We have some novel information that she's gonna adopt and place on there for us. I'm sure there'll be a button to take us to DPH2, but we want things that are particular for our town.
Yeah.
And so we can count on that right away. You know, we'll have some more information about staff later in the night, but we've been ramping up like crazy. It's just 5 things going at the same time, including senior center opened yesterday and just a lot of things. We're going to get to that, but this is, I think, our big kickoff because mosquitoes are the double-edged sword. The mosquito-borne diseases are important
Yeah.
to be aware of, and then there's the toxins that knock down the mosquito loads, and I don't think those are risk-free either. So we really have to keep our eye on the ball right now and not overkill. Do knee-jerk reactions, any of those things you want to discuss. This is really the first big test of the year for us right now.
Do you know, Brian, whether in the past there's any need for a resident to send registered mail to be on the no spray list, or is this all done online? How does technically, that was one question that came up.
Sure. Yeah, I think it was around 2017 or so that it did switch to an online process just to help streamline everything.
Okay.
And so it's going through that website, but we do still get some requests, and we get some from Reading as well, that will go through the health department or the clerk's office or something like that. Once we get those, we'll put them on our exclusion list. I would urge people to go through that online website because that's the new process, that's the official process. But if we receive an exclusion request, we're going to avoid spraying that property. We don't want to spray anybody that doesn't want to be sprayed. So
Sure. I would ask, in the past, and I haven't been aware of this, at least in Reading, but have you encountered a lot of controversy about the pesticides that you use in terms of their safety?
sure, yeah, we always have questions about that. The product that we're using this year is considered a reduced risk pesticide. It's not supposed to cause any adverse effects to humans or pets. It's actually used in tick and flea medication for cats and dogs in much higher concentrations than we use. So there are definitely always going to be concerns. I definitely understand that. Hopefully we can provide some information to help ease those concerns, and we're constantly looking at risk benefit, and when we have some triple E and stuff like that, I mean, we just want to keep the residents safe.
Okay.
I can provide more information at a later time if we have some on our website, I guess, about the products that we're using. I'm going to update that tomorrow or this weekend and make sure it's current since we're just starting that program next week.
Yep.
So we'll have some good information on our website about the products that we use.
May I ask a question?
Yes.
Yeah.
Ron.
Yeah. Hi, Brian. So after you update the information, could you please send me the link so I can look for it and put on our website?
Sure.
Thank you.
Yeah.
We'll just keep peppering Brian, I guess, until I can read his body language. It says enough already. But the the material safety data sheets, I don't know if those things are on your website. I didn't really see them, but maybe I didn't drill enough. But I don't mind having those. I don't think they're too technical for our population here in Reading.
It won't hurt.
And
Yeah.
yeah, it can't hurt to put those on. So the MSDSs will talk in fine detail on the toxicity of these products that were being used, some of which Brian alluded to earlier. Bacillus is in microorganisms that, they've been around for a long time. And I'm not going to sit here and be the one to say there's absolutely no effect to Mother Nature when we start bombarding her with, natural bacillus that are out there anyway. Because who knows what's going to happen in the future. We're getting to the point where we can measure in parts per billion and so forth. But for the time being, I feel very confident as health director, and I have in the past as well, that these products are effective on mosquito control, and they have no noticeable or measurable effects to, wildlife or even fisheries. Brian and I were talking before the meeting started, and Rick, I was in the commercial fisheries business for a long time before I, came into public health. So, that's an early love of mine, and I try to keep one eye on that thing. And those are really our first indices when we start seeing fish kills, drops in lobster counts, things like that. And we just don't see them with the products that Brian's using.
But I think it's a good point that, Brian, when you do update your website around the pesticides being used and report on their safety profiles, that there be some footnotes on, studies and references that people can go to look up, some of the original studies, or even other federal agencies that will list all the studies done. I think that would be reassuring to people.
Okay, yeah, I can provide that. Yeah.
When I actually did visit your website, and there was some reference to each of the cities and towns has a representative. Who is that representative from Reading? Is there?
Yeah, Reading. I have been in contact with the health director. So Peter.
Yep.
Okay.
That would be me. I missed the
hi.
meeting. He held a meeting earlier this year, and I just couldn't make it. But
okay,
that's my problem. He has been reaching out. It's true.
Okay, good. Any other questions for Brian? No.
Barry, I would just say this about barrier spraying. Later in the year, and as the fall sports start to pick up, and I wish I knew a little more about, Reading football, and I don't know what's going to happen this first year after the pandemic, but night games have always been a concern of public health officials, because later in the year we start seeing the surveillance data show that the risks are higher for positive mosquito pools. And then, so you got people out there nearby habitat going to night football games. So what we did in the past, Brian, and I guess we're just winging it right now, but can you tell us something about barrier spraying? So that's something in between. I don't like adulticide. I don't think it's effective, and only under extreme conditions do I think that it should be used. But the barrier spray, I think, is good intermediate, treatment. Can you talk to that a little bit?
Sure.
So that in September, when we're asking for it, we know if we're on the right page or not.
Yeah. Yeah, I think it can be effective. We don't do a lot of it in our districts, but we did do a lot in 2019 during the high EEE year.
Yeah.
And that was really effective because we're having high populations, we're having high vector populations. So we were putting some barrier treatments around some public areas like fields, parks, schools, things with a lot of traffic. And what that does is we'll spray some large vegetation in the area around the perimeter, not grass, not places where mosquitoes would go and land. That's the goal. So those places are also places where humans aren't crossing. So it's the places where probably people wouldn't even be in. So there's just less exposure there to humans as well. So what that product is going to do is going to be sprayed on large vegetation, and it's going to dry, and it's going to offer control for 2-3 weeks, something like that. It does break down in the sun. and it also gets washed away a little faster if it's raining. So a retreatment can be done. And as a mosquito comes and lands on it, it will kill the mosquito. Once it dries, it's not harmful to honeybees. We also try to avoid flowers, just for pollinators. So that's definitely something we could do. It's not a standard part of our program, but we have the equipment and the know-how to do it.
And Reading's menu allows for us to, get that type of service.
It
Our
does.
budget, not menu as much as budget. Okay, thank you.
Yep.
That's all I got. Carrie, I see.
Yeah, thank you, Brian, for the presentation. And you know, as you mentioned, you did it during the high IEEE year, and having just listened to some presentations with Dr. Katie Brown, I know we're in hopefully year 3 of that, cycle. I'm glad, Peter, that you could share that treatment option as a useful tool for this year, at least. It's not something you necessarily would have to use every year or at all times, but that's great information. Thank you.
Okay, well, Brian, thank you for coming, spending some time sort of updating us on this process. And, you'll be in touch, I guess, with Peter and Jean over the course of the season. If there's anything we need to address.
All right.
Great.
Nice job, Brian. Thank you.
All right.
Thank you,
Just
Brian.
Just
Thank
reach
you.
out if you have any questions. I'm happy to help. All right.
Thanks so much.
Take care. Have a good night.
Take care.
Right.
Bye.
Kevin, anything happening at the coalition?
Let me just pull up an email. So I think everyone was aware the last meeting was canceled, and they don't meet until the last, or the 4th, I should say, Wednesday of the month. But I did follow up with Erica on a couple of things. So Peter and I were talking the other day in regards to the new position that's going to be coming on board, falling under the coalition, which is that social worker position. Everybody can remember from town meeting, adding that on. And so I reached out to Erica and said, hey, I was having a conversation with Peter, and he'd be very interested if you would so be inclined for his input to help out with getting that position up and running, because really right now they're in the beginning process of just kind of researching it. So they're looking to other towns and cities that have such a position, where they house it, how it all kind of works. So right now it's really a very, very new concept, and I think they're creating it. I won't say on the fly. They always do very good due diligence and homework, but obviously it's a brand new position, so it needs to have the who, the what, and the how it's going to function. So Peter, she was very much interested in your input, and I said,
Good.
Great, I'll have them reach out to you, and you guys can talk in that regards. I also asked about, I remember you were interested in carrying the when the survey was going to come out. I think it was originally planned as the risk assessment survey they do every year.
Yeah.
Let's see, I'm just reading the email now. It looks like she's going to be presenting to the school committee in September about the findings. Because I asked if it would be ready for our July meeting, and she said it's not going to be available for right there. And she does have 2019 results if they wanted to share with us. But I don't know how. If you're, I guess, reach out to Erica if you're interested in 2019 results. I don't know how relevant it is given the past year that we just had, from one year to the next. So maybe it's relevant to look at what used to be a normal year to now.
Right.
So maybe it is actually relevant to look at both of
I
those.
think
So
it would be.
yeah, so it looks like that won't be until September by the looks of things here. That's all I have on the coalition.
In terms of the social worker position, so what you're saying is they're in the process of putting together a job description of what this person would actually be doing.
Yeah, so it's not only what they'd be actually doing, where is the actually going to be housed under? That's the other component to it. So the coalition is housed under the police department, so it would be technically become a police budget line item. Is that correct, Gene? I have that right?
You're on
You're still
mute,
mute.
mute, Gene. Okay.
I'm sorry, you asked what was going to be under the police budget?
The new social worker, which is going to be, I think they put it under the coalition, but the coalition's under the police, so it's all
Yes, it is. Yep.
under that budget, right? Yeah,
Yep.
okay.
Right. I know that in some communities, it's a line item to the police department, but the position sits, reports, it has a dual reporting relationship, and sits in Health and Human Services, or where there are other social workers, in elder services, if there's social workers on staff there. There's a lot of variation. I see, Paula, you nodding your head too. Yeah, there's a lot of variation. I don't know if anybody has decided yet what the best model is. I think they're working with it in their own departments and trying to see. So
Hmm.
I'd be interested to know kind of what they look into and what they decide. Because there's lots of ways to go about doing it. Have to decide what the need is and what's the best way to address it.
I can say that the existing social worker, public safety, and sometimes as needed health collaboration is very good. And the Elder Human Services team, social worker, nurse advocate are in very close contact with the team over at the police station who do community outreach and that kind of thing, as well as the coalition. So I think there is already a collaborative approach in place.
Yep.
How it formally gets organized, I think that's what Kevin is alluding to.
Well, could
Right.
I just butt in here for a second? Sorry. But, it was one of my messages early on that, as we're reforming here, reorganizing that, that's a place that public health belongs, in my view, is in the real important behavioral health services. And I will say this frankly, I haven't received an invitation to the table. I asked Kevin when he's at his coalition meetings if he could poke, and I think he just, returned something here tonight. But if the board is in agreement, am I a mover and a shaker? I used to be, I suppose, for something that is important, and this one appears, it certainly is something important to me. But I'd be happy to say, hey, where's health at this table? Come on. We have a board that's
I
very,
agree.
100%. This board member is right there. Were we in a different set of circumstances with our department, I would have been making noise a lot earlier about it.
I
and
agree.
Gene, I'm trying to read body language, because the last thing I ever want to do, and we're such good friends over the last 6 months, Gene and I have grown together so much in this job. So I'm not messing with her. That's the only thing I'm not going to do. But
Yeah,
I haven't
that would
seen a
be-
job
that would be
description.
A good survival approach.
Well, I don't even need to survive. It's okay. That's the beauty of this. But that's the real beauty of this. But I was there at town meeting when the discussions were occurring, and it sounded like an excellent idea, but actually, no real substance and form. And, there's a couple of movie lines that come to my mind, and follow the money, whatever you want to do. But I think we really need to ourselves to be heard. So I want to ping pong this back to Kevin and say, you as our coalition representative from the Board of Health, we've got to try to keep this alive and find out what would be the best and most, courteous way to get ourselves an invitation to the party.
Hmm.
Not to be too
Yeah,
pushy,
no,
but
I can certainly, I'll talk to Erica again. She's seemed very interested in having our input, so I think it's a non-issue from that
Yep.
standpoint, Peter.
yeah,
And
great.
I'll have her extend the invitation, and maybe, excuse me, maybe she'll have more information at the next coalition meeting, which I think it should be scheduled for, is it next week or the week after? I'll have to look at my calendar. which would be next week.
But nice job up to this point, Kevin. Thanks. I know you're the right guy to not
No
drop the ball.
Happy to help.
Thanks, Kevin.
I think we could, if and when they get a draft together of what this person would be doing. But, in my experience, there's two different types of social workers. And I think we're talking about, there's medical social workers who basically work with clients who they're either coordinating services or they're making sure they're getting into, their appointments, or they're following them through a journey of what they're dealing with. And it's really more coordination. And then there are social workers who actually do therapy, counseling. I'm presuming this is the former and not the latter. That we're not expecting this social worker to be doing actual therapy. Is that right? What did the town local?
That was one of the questions I had, because I thought
Oh.
some of it might be intervention, diffusing situations that police are called into, and
And that's
so I
one-
thought, yes, that indeed they might be doing some sort of therapy.
Yes.
Well, that's
They might be doing a
that's-
combination.
I was going to say, I think that's part of what's being worked on right now. The sentiment that I got from town meeting was it was going to be more towards a mental health side.
Right, right.
So
Yeah.
that's, but again, it was just
I
literally
think that's,
an item written in with the price
Right.
amount.
Right.
Zero.
I think that's what the need is right
So
there.
it really needs to be figured out, what is that best use of that money, in which avenue? Maybe it is a combination of the two. I know there was also a lot of talk in regards to the folks that brought it forward about staff and making sure that there's a mental health component that staff can tie into if they need to, from this position. So again, these aren't things that are written down anywhere and said to be the de facto way it's going to happen, but this is kind of what was discussed at town meeting, at least from what I remember. Maybe someone can
Yeah.
correct.
Yeah, I mean, I think that was the challenge with that conversation, is I think that there are a lot of different ideas of what this was or could be. And how it gets put together based on the good due diligence of our partners in public safety and at the coalition, identifying priority needs, may not meet the expectations of what each person that supported it thought was going to come. It'll be, I really look forward to hearing what their due diligence shows and how they choose to prioritize. Because you can have a social worker responding to calls with you and doing, de-escalation and responding after the fact for different things and
Follow up.
yeah, exactly. So yeah,
So
I mean,
I know Chief Clark is working directly with Erica on this, so that's which is good. So that kind of component can work itself in.
And you could certainly let Erica know that if she wanted to pass a draft to this board, we'd be willing to give input at some point if that's helpful, or Peter can do that directly, or.
Well, yeah, I think what I'm just going to ask Erica, we have a good relationship, so is just say, hey, I'd love to have Peter sitting in on these meetings with you all, when going through all of the decision making.
Sure.
He's a department head over here that has in a department that has a vested interest in this position. So
Right.
I think it's a natural kind of good relationship to be in, right?
Great. All right. Thank you for that update. We'll hear more about that in the future. We're going to move the health director position recruitment to the monthly report. We got two sets of minutes, one from our May meeting, one from the June 3rd meeting. And I wonder if there were any edits, comments, suggestions. I had one sort of edit for the June 3rd meeting. um, the, I think as I'm reading this, the motion that we passed, regarding the sending orders, the minutes simply, they're kind of redundant. They have the roll call at the beginning of the motion, then they have the roll call at the end of the motion. I don't know. We just need one or the other.
Yeah.
Do you see that, Jackie? In bold, near the end of the minutes for June 3rd. No?
So at the beginning where it says on a motion by Dr. Lopez and seconded
Right,
by
seconded
Harris?
by, the Board of Health rescinded as follows, which is fine. But then at the end of the motion, you have a second roll call. We only took one roll call, right?
Seconded.
Right. I usually put the number of votes at the beginning because it doesn't specify Paula at the beginning. I'm sorry, it doesn't specify Carrie at the beginning, just yourself and Paula.
Okay.
Right, because the first piece was the motion to consider, and then there was the roll call to, after the motion
Motion
was
to
read.
consider. Okay. So
Yeah.
that was actually accurate.
Yeah.
Okay.
Okay. So no changes there?
No changes there.
Okay. Sorry about that.
That's fine. My confusion. So I make a motion to approve both the May 20th and the June 3rd minutes as
Yes, I'll second
Via-
that.
Paula seconds. Paula, roll call, Paula,
Yes.
Carrie,
Yes.
Rick, yes. Okay,
Thank you as always, Jackie.
yes,
Yes.
thank you, Jackie.
Thank you.
Yep, nice job.
Thank you.
All right, the monthly report, Peter.
Okay, so as I stated in my last correspondence an hour and a half ago, maybe 2 hours ago by now, I'm not sure. This is something new. I was holding off until 5:30. We got all the reports in. And typically, you get your monthly report and then we recognize Christine and then Schwung, and then I speak for the environmental health piece. Today, I sent them to you piece by piece and inch by inch, and I don't know if that works or not, but we can critique this later. Tonight, if we open up what I sent to you, which is the complete monthly report, we can
The one
follow
that
down
says
together.
final.
Yes, the one that says final. It came to you around
Okay.
5:26, came to you at 5:26 this morning. If you want me to share the screen, I can do that.
Yeah, why don't you share the screen?
Okay,
That'll
so
make
I
it
can
easier
do
for
that.
everybody, I think.
Okay, so let's see if I can get any better at this. And okay, share. Okay, but I might have too many screens going before too long. So here is the final, and under epidemiology, the first section 1, and it has been related to COVID, and that's I don't want to make that disappear. We need to still have some remarks on it, and Christine is following up on that regularly. She would just give a report right now verbally, but I also sent, and I guess I could screen share that as well, is her written report to me, which I sent to you, but I'm going to pass it off to Christine. She can either read her report and you can follow along. Or if you read it earlier, you might have some questions for her. There's that kind of business. So Christine, and I'll try to get that report up while you're talking.
Sure. So good evening, and happy to report that at the present time there are only 4 active cases, and total case count for the town of Reading is 1,919. Deaths have stayed at 49, transferred cases at 10, and recovered 1,856. Excuse me, this is per Maven reporting, and data is subject to change. And during the meeting, I was just alerted of another case that came in, which segues into a cluster that we have at the present time at Magical Beginnings Learning Center, which is a home daycare. So instead of 3 total, there are 4, 3 children and 1 staff member. I have been in touch with the daycare owner as well as the epidemiologist assigned to the case, and the daycare will be closed through 6/21 unless there are any other positive cases that come through. But at the present time, that's the date. And again, I will be in touch with the daycare owner, checking in daily. With regards to school and athletics, I spoke with Mary Juliana this week and happy to report that there are no current cases at the school, and there's no clusters, obviously, for sporting events. They are still doing the pool testing, but school is out, and she is not sure if that will continue in the fall. I think that will, more information will be provided depending on the statistics over the summer. She was also happy to report that they had another COVID vaccine clinic for 12 plus there through PelMed today. And I do not have the data on that, but I'll be speaking with her again at the beginning of next week. So for the next report, I can include that. With regards to other communicable diseases at the present time, there are 2 Hep C. They are both chronic, they're not acute, and there are 2 influenza.
Christine,
And
That's interesting.
mhm. I'm sorry?
Finish your
said
thought there. I
that's-
want you to go back to the breakthrough cases, though.
Oh, sure. So there's been some webinars that I have been on with the Department of Public Health with regards to variants and some breakthrough cases. What we have been seeing, and statistically speaking, not very significant at the moment, but you know, data is being collected. There are cases on individuals that we're following that have had COVID in the past, over the past year, that have received both vaccines and that are testing positive for a second time. Their symptoms are not the respiratory symptoms. They don't have the respiratory symptoms and some of the other constitutional symptoms that go along with it. They're very mild, but that is data that we are looking at. And again, this is a webinar that I am on weekly with the Department of Public Health. So,
Christine,
more to
excuse me
come.
for a second, but is there a clinical definition for breakthrough case? And if I were to guess at the definition, it's going to be someone who's had the disease and the vaccine is now being seen with the disease again. That's called a breakthrough case.
Someone that has been vaccinated.
Okay, so just vaccinated and now getting tested positive.
Yes.
for. Thank
Yes.
you.
Mm-hmm. Welcome.
I guess you can shoot down to
And,
camps. Yeah.
Sure. Yep. So I am in the process at the moment of reviewing the YMCA and the Girl Scout camp medical records. And we'll plan to do an on-site inspection, I believe next Tuesday or Thursday for both those places.
That's going to be
That's
done
it.
with
Mhm.
sanitarians as well. I think we're going to have.
It will.
Schwang is going to shadow Christine, and Daniel is going to shadow Dennis, has some experience doing camps in other communities. Christine, can I ask you a question about the salmonellosis that we were tracking, and it wasn't from a Denver, a Reading source, but
That's
was it a resident?
Yes, it was. And that was from last month. It was a duplicate case, so I did ask the state to dedupe it. And so it was from May. It was not food related.
Uh-huh.
And yep.
Okay. So any other questions for Christine then? And before we turn it over to Shrunk, that was a good report, Christine. I think all my questions were answered. I don't know if somebody else might have. Kerry.
Carrie has questions.
Good.
Hi, Christine. Thanks for the report.
Hello.
I was just curious, when you talk about the breakthrough cases, is there any two pieces to it? Any information about the occurrence of breakthrough cases statewide or regionally? And any information about if there are particular variants that are being seen in these breakthroughs?
Yes. So what I have been told is that they are not routinely checking for variants. So that's something that has to be added on to the lab work. One of the cases that was a breakthrough case happened to be a pediatrician, and we had the discussion that he was going to go back and have further lab testing through his primary care physician, but that the state is not routinely checking for the variant itself.
Right. Okay. And so is this something that I'm just curious how they're characterizing it at the webinars, you know, if there's lots, if they've talked with folks in other states and what kind of experience of breakthrough cases they're seeing?
Yes, and again, I think that they are just starting to gather this information. With regards to the breakthrough cases, I've been on one webinar, and then there were several questions on the most recent one, which is this last Tuesday. So I do believe that I will have more information.
Yep.
And I'm sorry I don't write at the moment.
Oh, that's okay, Christine. You can't make up what you don't have. Thanks for the info. And yeah, that does make sense. They're not processing for everyone. There's not enough cases at this point to warrant that. So good.
Yeah.
Thank you. Thanks for everything you guys do.
Paula has a question.
You're welcome.
Hey, Christine, thank you again for your report. Just one question you might not have the answer to, but are they, do you know if they're collecting data as to which vaccine the cases?
Yes.
They are?
Yes, they are
No,
actually.
but you don't have
So
any
that will be
preliminary
interesting.
data?
I do not right now, but I will
Okay.
definitely, yep.
Thank you.
You know, on Christine's behalf, Mr. Chairman, Dr. Chairman, that is,
Rick.
we're all anxious, Rick. Try to keep it as formal. I mean, I slip easily, so let me start
It's
formally
fine.
anyway. You know, we're all excited about getting data and information, but we all know that this business, we're not going to jump to hasty conclusions. So Christine, the tough questions coming out there. I'm glad you're holding your own with this. And as the information comes out and we can count on it, Christine will be sharing it with us. You can count on that.
So I had two comments. Actually, one clarification is what I've heard going back months was that all three vaccines were highly effective. You know, anywhere from high 80s to the low 90% effective, which it would seem to me by definition means that there's always going to be a few percent of people who are breakthrough by the previous study. So I think having some breakthrough is not unexpected, but it would be interesting to know which vaccine and is it the variants that are breaking through. These are nuances, but some breakthrough is to be expected, right? Okay.
Yes,
That's a good.
I will definitely keep my eye out for that.
Thanks for clarifying that, Rick. That's a good point.
Yes.
And
We
then
don't want to alarm people unnecessarily.
exactly.
Yep.
And then the other thing is, I don't know, Peter, if you, under the COVID section here, civic and recreational issues, if you want to comment of how you're working with Jen currently going forward.
Yeah, thanks for the opportunity to share that, Rick, because I have spoken to members individually, at least Kerry and Paula and yourself about, yeah, we're not requiring the COVID addendum for any of the civic functions or recreational permits right now. It's all been lifted. I jumped to that conclusion after the June 3rd meeting. And then it occurred to me, boy, I better make sure I'm in cadence with my board members on this. So thankfully, we're holding face-to-face meetings from time to time, and this board is fantastic about getting up and come on down and let's chew on it for a couple minutes, and everything turned out to be okay. So right now, well, the most latest was this afternoon. What should we do with this piece that's on the let's see, the cloud, whatever it's called now, Open Gov. I asked her to park and lot it. That is a great document that we might need again, and we can either keep it in files at health, or if IT can keep it as a file that when we say, geez, we need to put this back in, we can do that even if it's a sort of an emergency meeting. God forbid we have to go back to those days, but if it comes up that we have to start, putting in place the precautions that were in place, we would be able to do it easily. But right now, Rick, we are not requiring folks who need a permit for a civic event or recreational event to even notify health. We never did it before, and we're back to not doing it now.
Right, so I think this was implicit in the motion we passed on June 3rd, which is that, at this point, we're rescinding the orders, we're looking towards the Commonwealth for guidance and mandates and advisories. There's such a low incidence that really the Recreation Department can do these without having a required loop through the Health Division. And I'm sure that Jen will contact you if she has questions, but it's not part of the formal process at this point.
Tell
Well,
us we
she-
missed her.
Go ahead. I'm sorry.
Well, we do when we don't. She contacted me, I think yesterday, and Christine was looped. I looped Christine in on it because I had some ideas. I think there's summer programs they want to make sure that they do. It's not mandatory to wear a mask, but if you want to feel comfortable, the social distancing, the hugging, even the fist bumping is still a good thing. The no hugging is a good thing, and she asked, did it look okay to you? It did look okay to me, but the only thing I could offer her, and Christine, I think, vouched too, she thought it was a good idea, is keep and maintain the records. God forbid we have to start doing social, contact tracing again. I think that's the last piece we drop. Let's collect data on everybody that's congregating. If we have to go back and start finding out what happened, we'll at least have that.
Yeah. Good point.
Makes sense.
I agree with that. Yeah.
Okay, well, we should move on. Shuang?
All right, so here I am back at the monthly meeting. I think, Shuang, you prefer to put up your own little screen share. If you'd like to, I have yours. It was well done again. But you want to do that for us? Or do you want me to?
Sure. I can
Okay.
share my screen.
I'll stop sharing here. You can take over.
Yeah, here is my monthly report regarding the vaccination in Reading. We haven't much difference from last month, May 18th. Through our town of Reading clinics, we fully vaccinated 567 people. And here is in the different age groups, starting from 18 years old. And here is the data from the MassGov. It's updated on June 10th. So the graphs in green, it's the total population in different age groups. And the graphs in blue are the fully vaccinated individuals. the main difference, the data was updated weekly. So the main difference from the week before is our age group from 12 to 15. We have 383 people has been fully vaccinated. And like Christine said, Reading Memorial High School is giving the students second dose of Pfizer vaccine today. So hopefully this data will increase next week. And so overall, we have 16,604 individuals have been fully vaccinated in Reading, and it's about 60% of the total population age 12 plus. And since January, we had 27 clinics in Town of Reading, through Town of Reading clinics. And the total dose was given are 1,121. Vaccine received and ordered. So starting from January 28th, we received this amount of vaccines, including 70 doses of Johnson & Johnson vaccine received on April 5th. After our homebound vaccination, we have left over 40 doses of Johnson & Johnson vaccine. We had a walk-in clinic today at Pleasant Street Senior Center, and we also informed the local pharmacies, including CVS and Walgreens. Well, we haven't get people coming to get vaccinated, and those Johnson & Johnson vaccines the expiration date was updated from June 10th. The FDA approved an extension of the shelf life for the Janssen COVID-19 vaccine from 3 months to 4.5 months. So the updated expiration date is August 7th. It was changed from June 23, which is next Tuesday. So now the Johnson & Johnson vaccine can keep to August 7th. We might think to have other clinics to use these dose of vaccines.
Can we stop there for a moment, Shrung, and explore this a little bit? I might need some input from the board. We were prepared to destroy whatever we had left on Johnson & Johnson after next Tuesday when it expired, and now we just got an extension to August 7th. Did you get anybody coming in? So Shrung has been at the senior center, and so has Christine, since it reopened, and today they were holding a clinic. Did we get anybody in there for a free walk-in vaccine?
No,
And so you were
no.
there for at least 4 hours? Were you there for 4 hours or something like that?
Yeah, about 3 hours.
So, I mean, we could either start to, go public with it. I'm not sure what it's going to feel like. To me, that Johnson & Johnson is a valuable vaccine for people who are on the fence. Hey, get it once and
Right.
one and done. Come on.
Right.
But I'm not sure what the board thinks.
Make a comment. If I could make a comment, Peter,
Yeah, of
too. I
course.
think what Shrung did today was really a great idea. She contacted the local pharmacies
Correct.
and she let them know. Yeah, I thought that was pretty awesome. Great idea.
That's in line with what Gene, I think Rick was talking about earlier in the season too. Why aren't we partnering up with some of the local pharmacies? Shrung did find a crack in the armor, if you will, and we went. They didn't refer, we would go over with, here, use ours, please. We just don't want to see it, go to waste.
Right.
But nothing's happening.
Right. Is there a way to do outreach to the local pediatricians or medical practices and see if there's
Oh, that's a great idea.
interest there? I'm sure they have their supply, but they might, be glad to know there's other options. Don't know if they have J&J.
Actually, Actually, you know what? That's a really great idea. And I did receive a call from Reading Pediatrics, and I will follow up with Shuang on that.
Great.
But they were actually inquiring.
Good.
Yeah, so just want to let you know, J&J is only good for adults.
Oh, that's
so-
right. Sorry. Yep,
Oh,
you're right.
sorry.
I apologize. Yep.
But
Thank
we
you,
can-
Shuang.
No problem.
Thank you.
You can contact other health care
Right.
facilities or like local offices. Yeah, that's a great idea. Thank you, Carrie.
Sure.
But good catch, Schwung. That's
Yes, yes.
Mm.
That's why she has the
Yes.
job she does.
But we need all the creative thoughts that we can process too. So if you want to continue, Schwung, I don't think I have anything else on up to this point. If anybody else does, certainly jump in.
Yeah, actually, the vaccination report is end, and I just wondering if we can put information on our website. Maybe anyone wants J&J vaccine, they can call in. We record their number, and when we have the other clinic, we can call them. Then they can just come in.
Good idea.
Yeah.
Good point.
Okay.
The other thing is, have we completed all the homebound patients that?
Yeah, homebound has, we completed in Reading, and the state also take over of all the homebound requirements.
I see.
Yeah.
So and the people can have more options because state also provides Pfizer and the Moderna vaccine if the homebound person needs the other type of vaccine. But we only have Johnson & Johnson, so they can have more options through the state program,
the
and
state
it's already put on our website.
Yep.
Okay.
Yeah,
Um,
and okay,
Pa-
I just want to, yeah, go ahead.
It was just a comment that I was gonna make. Has anyone heard anything about people who have gotten one vaccine of one type and one from another? And that apparently that their immune response is even higher. I don't know. Yeah, I just think it's interesting.
Yeah.
Mm.
I've heard that in the beginning of we using Johnson & Johnson. They said if you have one type of vaccine, you can have the second dose Johnson & Johnson. But it's good to know that it's more effective.
Yeah.
Okay, so I just will have a few sentences for our town website, the future plan. I want to share with you a screen. Let me stop for here. First of all, I do realize the mosquito control in our Reading town website is out of date, as well as some other parts. I talked that with Peter before. So we're gonna start off doing our health department's website. And this one is from Winchester Public Health Department. I just think it's a great example for pest control. We can have mosquito ticks and rates. So we will starting rebuild or reorganize our department website very soon, and I think we will start with mosquito control.
Great. Thank you.
Good.
You're
Okay.
welcome. Yeah, any other questions?
If I may, I just, not a question, but just sort of a thank you, because I'm remembering the discussions about management of the the vaccine shipments and management of the vaccine storage and keeping track of, who has been vaccinated and where are the clinics happening. And it was a really complex operation. And, I know you and Peter and Christine were really busy working hard and collaborating with Fire to keep track of what was a moving target, they'll say, right? Over a long period of time. And I don't know, I guess seeing this made me, reminded me of a couple of conversations I got to be part of, and sort of when's the delivery coming, and do we have this, do we not, how to coordinate with the homebound services. You know, there was a lot to it. So I wanted to acknowledge that. And
We
say,
were all in this together, Kerry. Cut it
Yeah.
out. And you
No,
were
no,
there
that's-
too. So, I mean, we can pat ourselves on the back. It was a busy year, and one that we want not soon to forget. At least
No.
I hope not.
no, and I
You
just
never know at
realized-
my age.
Right. I mean, Peter, I just was calling it out really because it felt like
No.
it was one of those things that it's a little invisible. And unless you're part of the conversation, you know, it's a little complicated, but the range of partners and the degree of complexity, you know, was very real. That's all. It's yeah,
And very appreciated.
very much so.
Thank you, guys. Thanks, everybody.
Yeah.
Okay, so shall we go back to screen yes, screen share on and nice job, Swang. Anything else for her while we have her? Oh, God. I don't have the right one up here. I think the last thing I sent to you guys had some red numbers from Daniel.
Yep.
And this isn't it, so I'm not going to share that. Well, if you have those numbers, now I'm going to start to jam. It was a screen scare, not a screen share. I guess I'm going to wing this one. Daniel did plug in numbers. He told me ahead of time that the numbers have not changed considerably, but he assured me that his inspections are done for the first half of the year. I can say that we've been spending extra time working on coordinating the camps, and there's a learning curve for that. Even Christine was involved with a roundtable with us about, oh, let's get out the regulations and go through them again. How do we do this? I mean, I've been out of shape for a couple of years, and I don't think we had camps at all last year.
No.
That's when I was down. And so we're coming back and we're learning it. So we spend extra time right now trying to get our files together and who and how are we going to inspect these things. I can say that he has done good work on getting the pools together. And those, I think, are slightly ahead of schedule. I was actually talking to a fella yesterday who runs a pool in town and a few other towns too. And he complimented, you know, Reading's job. He's not ready to open, but we're ready to inspect for him. And that's usually not the way. Complaints. I mean, I thought there'd be more rodent complaints by this time. And I asked Daniel to put them together and really, and I guess it's the antithesis to the adage that if you build it, they will come. Well, we don't have anything built right now. So nothing is really coming here. We're not ignoring people that are calling in, but I think they're figuring out that there's another way other than town hall to kind of resolve some of these issues. Once we have a very active environmental health program out there, I'm sure the people are going to be calling, but this year we've only had 2 complaints for rodents. And if I'm wrong about that, Gene, speak up by all means, because I know you were getting the calls. I think maybe Bob was getting them because we didn't even have a network of phones on how do we manage the calls coming in. So we've been working on a kind of a controversial housing inspection, and I think that's kind of working itself out. It was an issue that is now a non-issue, but it has to do with some, you know, people that are, you know, having difficulties working within the system, and we can't solve everybody's problem. We just can't. So there's an attorney involved and stuff like that. For the most part, and when we get to the personnel piece, which is going to come further on down the line, I can talk about some more changes that have happened, and that might help indicate what has kind of tied us up. I'm doing 2 things at the same time here, so stuttering. On why we're not too comprehensive in our reporting on inspections for this month. There's been other things that have taken a priority. So let me get that, see if I can get the right one up this time. Final. All right, well, it's still not up here. So are there any questions about any of these other things? The drinking waters and the hazardous waste really has been quiet out there. And hearing none, I will move along. And the cooling stations, I'll give Kerry credit for this one. She texted me somewhere. I'm not going to say in the middle of the night, but it was in an off hour, and it says, "Oh my," she's exactly on target. We do cooling stations during heat waves. This last heat wave that lasted a few days was, can you see this? Am I still screen sharing?
No.
Oh, all right. Sorry, let's see if we can. Bump something. Okay, right. You got it now, right?
Yes.
Oh, thanks. Wait for someone to say something.
Yeah.
And so for the cooling station piece, and I tried to fold it into how we ended the meeting in May with some discussion around command. So I did talk to Kevin, let's see, Bo Miller first, and he was all positive about it. They have a plan in place here in Reading, and it doesn't surprise me. I just wasn't aware of it. But I took it a step further and caught Chief Burns and said, can you give us a little time on this thing in case it comes up? And did you read his email, or do I have to get that up? He basically stated that, yeah, and now that we have a director of health, we'll include the health director as well in the discussions on when he also uses the library.
Yep.
I'm not sure if everybody was aware of that, but that has more hours than the senior center does. So we go to the library and the senior center to get cooling spots. The information I got, though, and it was very casual, was that not too many people take advantage of it. Kevin runs movies to invite people to come down, especially on weekends when it's in the midst of a heat wave. So we can feel assured that the next time the weather gets hot for a few days. And how do we know when to initiate this? Well, the Homeland Health Alert Network, also known as the HAN, HHAN, notifies the locals, and we get our marching orders, so to speak, on emergencies when the phone rings, and it's the HAN telling us we should think about cooling stations, or to let them know where our cooling stations are, so they can place them on the state's website as well. So that's in pretty good shape. And thanks, Kerry, for bringing that to our attention. We got it wrapped up pretty good. We'll see what happens the next time we have a heat wave, but for now I feel good about it. So community health and promotion, let's see. Okay, the grant update. I mean, there's nothing else you can say about that, except if you saw the email, the final email I sent to Gene, what's Ron's name?
Ron O'Connor.
Ron
Oh
O'Connor.
yeah, Ron O'Connor, thanks. I won't describe what just happened there, but it was a senior moment, perhaps. Ron O'Connor got the email, which said thanks a lot, and we look forward to, another opportunity or another bite at the apple some other time. And if anybody wants to talk about that, this is the time. But I mean, that ship sailed. We weren't on it, and I am very disappointed. I think Jean is too, because she worked her fingers to the bone. She did. She really did.
Yeah. I mean, I'll just say, having attended the meeting with that Reading went to with Linfield to discuss the opportunity, it seemed like they were on board and that it was a worthwhile thing. And I really appreciate all the work you guys put into it. I know what it's like to write grants. It's a lot of work, so it's disappointing that it didn't pan out the way that it seemed like it would at the beginning. But it was great effort, and I know that the Office of Local and Regional Health is interested in funding further public health excellence grants and continuing to promote shared service opportunities. So I look forward to us applying again.
I'm not going to let it obsess me, but if I had to write 16 pages on what happened, I think it would begin with the commitment we got from the top down. Bob was all in. Prior to that, Jean was all in.
Yep.
And then Linfield was all in, and I'm not going to carry on from there. Let's see. the assessment update, I think Jean is gonna go with that one, but Kerry might have some news on it too. We all heard from my emails that Wong has a new job, and I don't know if that's an inside pitch or an outside pitch, but it's not a good thing.
It's a fantastic thing from Massachusetts
Okay.
and for the Office of Local and Regional Health and for local public health. It's a fantastic thing. I did reach out to Sam. We've known each other a long time. And he said he's, you know, in communication with MAPC about his inability to continue in a relationship. He's offered to recommend other folks. Peter and I have talked about some other folks as well. And I guess the question is, you know, do we go back to MAPC and sort of compare notes on who they have to work with? I'm not sure quite how to navigate this next step.
Jean's going on vacation in about an hour. But
Good
maybe
for
before you do,
Jean.
before you do, can you give us, you know, your worldview on how this will most likely proceed?
Sure. Thank you. I did speak with Mark Fine yesterday, and I've worked with Mark for a lot of years and worked with MAPC for a lot of years. And the good news is that there's a lot of flexibility, and that we don't have to decide anything right now, tomorrow, next month. They have some ideas. They feel that, you know, this last curveball is not a major obstacle, and I think it's just coming up with another person in the subject matter expert field that can devote the time that's needed to this. And I think we can probably figure that out going forward.
I
mean,
know that was when I got the news. I was like, "This is wonderful." Wait,
Yeah.
damn.
Well, the good news is the money is all ready and waiting, so you don't have to worry about the money. We took care of that a few weeks ago. It's all been moved over to the new department. I don't know the mechanics of how that's all going to work after July 1. Obviously, I don't have any authority over that department, and I don't think I can't even see the budget, to be honest, but I've double checked with the town accountant that it's all moved over. Jackie was super helpful in giving us a hand with that. So we're one town, no matter where it sits, we can work it out. And the good news is we still have plenty of time to give this the thought it needs and give this the time it needs. There's no ticking clock. So that's the best news I can offer.
And it's great news.
Thanks for all your efforts, Jean, and have a wonderful vacation.
She's not really taking a vacation. She says it's going to be vacation time, but she'll be doing stuff. Don't worry. Rick, do you want to have the last word on this before, you know, I mean,
Yeah,
I guess
no,
it just,
you know, I think that I would like to see it, you know, move along, have a kickoff meeting. We talked about coming back with a more detailed work plan. And then there's this issue of who the consultant would be. It's not, you know, this internal assessment is not hyper urgent in that I think we'll have limited ability, even if it happened tomorrow, to be able to, you know, readily implement all the changes or recommendations or any recommendations they come up with. So but I'm feeling like, you know, we're entering into the summer, and it would be nice perhaps by the next meeting to have something, some movement on the whole process, even if it's just a kickoff and, you know, a decision on the consultant. And, you know, undoubtedly the report is now well into the fall or September, October, but that would be my only comment. You know, I'm just hoping that we have some more in our July meeting. Are we getting there?
it sort of segues into the next piece here on item number 3. We go from the assessment. We have had discussions in the past about, gosh, wouldn't it be nice if we had a new director when this was happening? That would help the new director kind of get his footing in place and so forth. So again, I guess I have to pick on Gene about any news around, and I do have access to news. I'm trying to stay away from it because I really don't know, what role anybody might have for me. So we'll stick with Gene in HR as the key people. But what can you tell us, Gene, on all the folks that are dying to work for Reading?
Hiring is tough. I think I said that a couple of times. It's just a really difficult, specific kind of a job to fill. So that's what makes it tricky. And we've had a couple applicants. It's been about 3 weeks, not quite a month. So we'll just continue to push it out and, through anybody's network, board members, health folks, anybody anybody you can think of. I found a random email in Laura Vlasic's old inbox that was from a student that was, I reached out to that student and said, just want to help get the word out. Here's the link to the opening and that kind of thing. So I think it's just a slow and steady process to push this out and see what we get for response.
I just wanted to mention, I did talk to Bob about board input. He said that sort of in the past, generally the board chair has been the link during the recruitment process, and I'm certainly happy to do that unless someone else has a dying desire to be involved. I don't. And I think the other thing he mentioned, which I thought was actually kind of interesting, was that one way the board could provide input would be to potentially come up with a series of questions to ask candidates. We may have more substantive, and for those of you who have done interviewing of candidates in any positions, asking questions that sort of force the candidate to think about what a solution is, as opposed to a simple, thing that the response just kind of rolls off your mouth. Presenting a situation. What would you do in this situation? How do you do this kind of, really? So I think that I thought that was a good idea, and I think maybe over the next month or two, either at a meeting, between meetings, we could talk about it, maybe come up with half a dozen questions or so that we would like the candidates to answer and respond to. It may help us. And so I'll just mention that.
That's good advice, and that can be done ad hoc, I believe, and I hope that's the right word. In other words, if we start to get candidates and we're getting ready to do some interviewing or some screening, I can just notify board members and say, shoot me your questions.
Right.
And go from there. It doesn't have to be done during a meeting.
Right. Yeah, I'd be very interested in doing that. I have some experience formatting questions for committee interviewing for a variety of roles. And as you say, Rick, kind of using the tapping into the think on your feet kind of thing, and tapping into different things about sort of what their collaborative style is or what their reporting style is, and all important things in these kinds of roles. So no, I think that's a great way for folks to be able to participate. And I'll just add, and Peter, please, add in, just from my contact with folks working in local health right now, people seem to be kind of focused on, trying to get vacation time that they haven't had. And so it's not necessarily the time that folks are picking their heads up and thinking about shifting, they maybe are thinking about they want a new job, but they're not ready to do that. Yeah, and I see you nodding your head, Jen. Yeah. So I would put it to a timing thing. And that would maybe a little bit more time, we let it ripen and do some more work pushing the message out. I think that there will be more applicants. I hope.
Timing is definitely a big factor when you're hiring.
Yeah.
Summer is less than ideal.
Yeah.
And coming off of an international public health pandemic is less than ideal.
Yeah.
Well,
But-
maybe, yeah, you never know.
You don't
But
know.
maybe moving along though, because this report kind of strings along, one thing leads to the next. And, if we're done with the director's position and
Sure.
rather than see it as a dead end and let's sit and wait, I will give you the most exciting news of the week. And it's got to do with an update of our public health nurses position. And Schwung was offered and has agreed to come on full-time. That's 37.5 hours per week. So we have a full-time public health nurse on staff, one that we like, one that we love, and who's doing a real great job. Schwung has finished her master's degree while she was working for us part-time. So she is totally involved. There's no doubt in my mind she's got the bug. And I know something about when you get that public health bug, it's hard to shake.
Yes.
And she's going to be with us for a while, I think. So that's the good news. If we don't have candidates coming to us, and I'm not going to make any commitments about homegrown stuff, but I do have plans for Schwung, and I've talked to board members individually, and I will say, let me start by saying, Kerry has her foundations program starts July 1st. Schwung and Daniel both agreed to start on it. I want it done by September 2nd. Paula has spoken to me about it and has agreed to do some mentoring, and that means we will get study group going together. Rick, if you're interested, we can certainly fold you into that. I think this is an excellent opportunity for all of us, except for me. I don't want to learn anymore.
Oh, you
But,
already-
but seriously, let's get some cross-pollination going. We can get a room and we can blow it up on a screen and go through these self-paced learning modules and as a group. And I'm certain we can find, some discussions to go along with what we're learning and what's happening in the community at the same time. Daniel has done one of everything. There's no doubt in my mind, this guy is good. And he's not there yet. I've been talking to him frankly about how his expectations should be elevated to something better than we've seen ever in this town on environmental health. I think he's up for the job. I just think he's got to figure out what am I talking about? And I think the good news is we have these programs that Kerry actually developed right here. That's homegrown. So let's get Schwung's full-time. Let's get her rolling in this. And who knows what's going to happen in, 60, 90 days. I have a timeline. You all know about that. And this is not about me, but let's keep following the bouncing ball here. We went from public health director to the news about Schwung and to the foundations piece. And if anybody else wants to join in, we can continue talking about that. And, this next piece, number 4, this is huge and it's so timely. It's like, I'm not scared. It doesn't scare me because we were on top of the world a couple of weeks ago with Sam Wong and a grant in our pocket. And now things come and go in this business right now. And it's weird, but we were stuck with an animal control. And I got the word just this morning that the town manager in Wakefield will be talking to the town manager in Reading. And we have a real good team of animal control people. I reached out to them earlier on and they were too busy, but their main boss a guy by the name of Steve, what is it, Gene?
Steve Mayo.
Oh, yeah, Steve Mayo in
Steve
in
Mayo.
Wakefield. I guess he's a good guy and they want to please him. And Steve Mayo said, let's do something collaboratively in sharing services. We know that word, we know that phrase.
Yeah.
So that just came up today. We're going to see more comprehensive and organized animal control. We've been lucky so far. I tell you, I grabbed a person and it's really too much for us, but we're good now. And I guess the final piece, this one was left off of last month's meeting. We got a little, I don't know what happened, but I guess I just wasn't in control. But we did have a tobacco control compliance check done last month, and we came back 100% compliance. I mean, this lady, Maureen Busby, and if you haven't looked at my stuff that I sent out at 6 o'clock or 5:30, yet you might want to go back and check it out. But she went through so many different places that sell tobacco products, and we can feel really confident that the tobacco control program, which is miles over the horizon as far as I'm concerned, from where it was before the infectious disease took all our brain cells. Tobacco is still out there. It's not something we want to ignore. We had to park it someplace. But the good news is that when she came back and did the compliance checks, try to get this thought over with, we were 100% compliant. So that's the
Great.
report for the month.
Great.
Great.
Thank you, Peter. That was great.
Yeah.
I'm going to stop the sharing. Well, it was good discussion, and it
Yeah.
carried on for a little bit longer. And if you get sick of my voice, you just need to speak up and take over.
Mhm.
That's all I got for
Thank
now.
thank you, Peter. That was really good. So the next topic is this reorganization voting. So as I think I mentioned last time, we're required between June 1st and July 31st each year to vote for chair and vice chair. And so even though we've kind of done this twice in the last 12 months, we need to do it again. And so I guess I would start with nominations for the chair position from the board members. Carrie.
I nominate Dr. Rick Lopez.
Thank you.
I second that nomination.
Okay. Roll call. Carrie,
Yes.
Paula,
Yes.
Rick. Yes. I appreciate your confidence in me.
No, you've done a
Last-
great job.
Yes.
I think that, you know, the next 6 months is really going to be, there's going to be a lot of action going. I know COVID seems to be receding, but there are lots of other stuff happening that'll keep us all busy. So thank you.
Absolutely. Yeah. Thank you for all of your work this season, Rick, and thank you for agreeing to take on the role again.
For a bit. Thanks.
Yes, indeed.
Yeah, I just want to mention real quickly, Rick, I don't think I've ever seen this before. Someone's come onto a board and instantly, just about, is thrust into the chair position. So really a great job picking up the ball and running with it under very, very extreme circumstances, to say the least. So
Yeah.
glad to see you stayed on for another term.
No, thank you. Yeah, I when I started in July, really didn't expect how things were going to play out like this. I thought, never know.
Par for the course over last year.
I don't want to hang this up, but I remember, I think it was my first official meeting was when I heard that Eleanor was going to be stepping down. And
Yes.
I was like, whoa. So
Yep.
we just kind of,
I was in panic mode at that point.
yeah. Like, wait, does that say what I think it says?
Yeah.
So, yeah, so hopefully, this new year, this new fiscal year will be a little bit more easy rhythm. And thank you for keeping us in that rhythm, Rick.
Yeah, absolutely welcome. And so the second piece is around nominations for the vice chair.
And I nominate Carrie.
And I second that nomination.
Thank you.
Discussion, roll call, Paula,
Yes.
Rick, yes, Carrie?
Yes.
Great,
And
thank
thank
you.
you for
Thank
all
you.
your expertise that you bring to this
Yes,
too,
you bring
Carrie.
so much knowledge to this that.
Oh my God, so much
Just-
knowledge. Yes, thank you very much.
Unbelievable.
You would be
Thank
lost.
you.
Thank you.
Thank you. Really nice to be able to contribute. I really appreciate it. And I really appreciate working with this board. It really is, it's a pleasure, all of
It's
you.
an absolute asset to have you, that's for sure.
We
I
love your
really-
engagement.
Very lucky, very lucky.
Thank you.
All right, so that is it for tonight. I don't know if there are any final comments, items, anything you want.
Oh,
Jane?
Jean,
So you all know what a planner I am, and I've already looked at the calendar from calendar year.
Yeah.
And there's a couple of things to keep in mind. We don't have to worry about it right now, but we bump into a couple of things. One is the Jewish holidays in September, and another is subsequent town meeting in November. Subsequent town meeting, we never know how many nights. We haven't even thought about town meeting, but I just wanted to bring that up. And as we think about dates for future meetings, those are a couple of things to keep in mind. So I know it's always the third Thursday, but it may want to shift around a bit if you take a hard look at the calendar. And Rick, I can send you what I have built for a calendar. It's all of the boards, committees, and commissions for the whole rest of the calendar year. You can see kind of town meetings on there and some other things. So
That would
if
be
you're
helpful.
interested, I can send that along.
That would be helpful.
Okay.
So we're scheduled for July 15th, and I'm hoping we have a quorum. Everybody's going to be there. Paula, Carrie, you,
Yeah,
Jerry. Yeah. Great. Okay. Motion to adjourn. Do I have a second? Paula? Roll call, Paula,
yes, please.
Carrie,
Yes.
Rick, yes.
Thank you
Thank
all.
you all.
Yes.
great
That's a
meeting
lot of
tonight.
good
Thank
work
you.
done.
Thanks,
Thank you.
folks. Thanks, everyone.
Have a good night.
Well.
Good night.
Good night.